This segment of Kababayan Today is brought to you by the Cancer Center of Hawaii.
Mga kababayan, ako po si G. Tanji at kasama natin ngayon si Dr. Laeton Pang, and we are at the Cancer Center of Hawaii. Hello, Dr. Pang.
Hello, mabuhay, is that right?
That is correct. Thank you very much.
Yes.
So let's talk about the Cancer Center of Hawaii. I know there are several locations here in Oahu. Can you tell us more about where these locations are?
Yes, we have two locations. They're very conveniently located. One is on the grounds of what used to be called St. Francis Liliha, here just outside of downtown Honolulu. And the other is at what's now Queens West out in Ewa Beach.
Okay, so there are two locations so that people don't necessarily have to drive all the way to downtown if they're closer to that area. So that's
right.
very convenient for them.
Yes, and we're also building a third center at Palimomi in Aiea.
Okay, expanding then.
Yes.
Okay, so let's talk about the services here at the Cancer Center of Hawaii. Can you share with us what you do to help people on a regular basis?
Yes, we meet with cancer patients to discuss what their options are and to formulate a treatment plan for them. We tailor each treatment for each patient individually. So every patient gets their own treatment plan that's best for them.
Okay, let's talk about the Filipino community in terms of the Cancer Center of Hawaii. I know that a lot of Filipinos live here in Hawaii, but among the demographic of your patients, would you say that there are some Filipinos that come to your center?
Oh yes, yes. Our patient demographics are pretty common or similar to the Hawaii state population. So about a quarter of our patients are Filipino.
Okay, and we also know that there are a lot of Filipinos in the care industry as well. So I'm sure they're here working too?
Right. Actually, a little over a third of our staff is Filipino.
Okay. As they say, Filipinos know how to care. And they also love taking care of people. It's sort of built into our culture, not just as Filipinos, but even here in Hawaii, you feel that aloha spirit everywhere, yeah?
Yes, that's part of our motto, actually. We care.
Okay, so let's talk about the different options. Should someone find out in their family that they do have cancer, what options are available to them here at the center?
Well, we specialize in radiation therapy. So we do have medical oncologists that do utilize our space, but we specialize in radiation therapy. So we provide radiation treatment services, which are applicable to about half of the patients. And X-ray treatments are used in a variety of settings to kill cancer cells. There are a few non-cancerous conditions that we also treat, but the vast majority of patients that we treat have cancer.
Okay, so could you walk us through the process for someone that does not know what this process is like for an individual? What is radiation like?
Well, radiation is just getting a high energy X-ray. So you don't feel it, you don't see it, you don't smell it. We do have implant services available where we implant radiation into a person, but a patient is not radioactive unless we leave a radioactive source in them. For example, in a prostate brachytherapy patient where we implant seeds, radiation seeds into the patient, then they have some radiation in them. But otherwise, patients are not radioactive. They're not made radioactive. They're not going to glow in the dark. So we meet with them, we talk to them about radiation and what it is, what it does, and what we plan to do for them, what they can expect through the treatment, and how effective it is.
So Dr. Pang, can you talk to us more about the different cancers that you see from the Filipino community? What are the most common for our kababayans that come here to the center?
Yes, well, just like most Americans, the incidence of the most common cancers has been rising in the Filipino community in Hawaii. So the incidence of lung cancers, colorectal cancers, prostate and breast cancers has actually approached that of the rest of the community. So the most common cancers that we see here are breast cancer, lung cancer, and prostate cancer. Of course, as you know, amongst the Filipino community, thyroid cancer is also very prevalent.
Dr. Pang, can you please talk to our televiewers and give them some advice should they find someone in their family that does have cancer? can you share advice to them, please?
Yeah, well, understandably, cancer is a very serious diagnosis, and so many patients, when they get that diagnosis, they're scared. And when they tell their family members, unfortunately, a lot of people don't know how to respond to somebody who has cancer, and they start treating them like they're already dead or dying. Or they tell them about the worst experience that they've heard about, or somebody they knew who had cancer and had treatment and something went terribly wrong. And of course, that's not very helpful to the patient. So my advice would be try to be supportive, tell them that the treatments for cancer have improved over time and that there's a lot of hope. You know, try to maintain their hope.
Could you please invite our Kababayans out there to come to your locations to check out your services?
Yes, please come and check us out. Give us a phone call. We have 2 locations, again, one in downtown Honolulu, or just outside of downtown, and the other one out at Neva Beach. And our phone number for the town facility is 547-6881, and out in Neva Beach it's 678-9000.
Okay, and that's 808 for sure.
808.
Yes.
All across the state.
All right, Dr. Pang, thank you so much for speaking with us on Kababayan Today, and for all the work that you do here at the Cancer Center. Our community thanks you.
Oh, thank you.
All right. Thank you. Signing off, I'm G. Tanji.
This segment of Kababayan Today is brought to you by the Cancer Center of Hawaii.